Are there cases of Zika in Belize? Zika is a mosquito-borne viral disease that made headlines back in May of 2015 when it spread to epidemic proportions in Brazil, causing abnormalities in newborn babies. But according to the Director of Health Services, while it is considered an emerging infection, Zika is not a new virus. It first surfaced back in Africa, Southeast Asia, and the Pacific Islands.
Zika is not a new virus. It's become a buzzword, I guess, because of what's happening in the media and the increasing number of countries that are reporting Zika virus. But Zika virus can go back to the 1950s when it was first documented. It was more prevalent in Asian countries, some African countries, and it didn't really make its way in the epidemic proportion it has done until it did so over the last couple of years. Brazil has been the country that has been most affected. Entire regions in the northern part of Brazil are the ones who have reported an increasing number of cases, so they have an ongoing epidemic. And of course, countries around us, and I believe all Central American countries have reported at least a case. Not so much so the Caribbean islands, a couple of them have.
The most common symptoms of Zika are fever, rashes, joint and muscle pains, and conjunctivitis. Some infected persons also experience headaches. These symptoms, says Dr. Manzanero, are similar to that of dengue and chikungunya, both of which are in Belize.
It bears some similarity to chikungunya and dengue in that the clinical characteristics can be the same, and because it is transmitted by the same vector, which is why it makes it a little bit, it will mimic, or it's expected to mimic dengue or chikungunya epidemics. That's can be a tricky situation, both from the clinical side and from the personal side of the persons who may be having signs and symptoms, because if you go to a clinic with fever, headache, rash, general malaise, the first thing on the top of my head perhaps can be Zika because of what's going on right now, but dengue is also a common entity, and chikungunya, so you are not going to be able to perhaps make the differentiation in terms of clinical characteristics between Zika and dengue because they are similar, which makes it a little bit difficult. So even when you go to a health facility, you more than likely will be tested for dengue first. If that is negative, you perhaps will be tested for chikungunya. If that is negative, then you go and be tested for Zika, which is kind of like the same algorithm most countries are following.
There is no known vaccine or medications available for the prevention or treatment of a Zika infection.
The Zika virus is not something that we can test for in Belize. We will have to send your sample outside of Belize in order to make the diagnosis. It's a virus. It's not. There's no treatment for it. So even if you show up and we think you have Zika, you're going to get Tylenol, the usual fluids, bed rest, that kind of thing.
Last Friday, the Centers for Disease Control and Prevention issued a travel alert for Mexico, Central America, South America, and the Caribbean due to the outbreak of Zika virus in these regions and its connection to birth defects. So is Zika in Belize?
We may already have cases of Zika. Now, the issue is not closing the borders. I mean, it's a tropical disease that we are going to have to live with. It's how you go about dealing with all vector-borne diseases. The fact that we are more urbanized, the fact that there's travel, the mosquito travels as well, not only the humans, the fact that we also are more mobile in transportation, land, air, all of those are entities that are going to contribute to epidemics, like what happened with Ebola, for example. So we may already be having Zika cases, it's just that we haven't reported it.
Unlike hemorrhagic dengue and severe cases of chikungunya, hospitalization is uncommon in Zika and deaths are rare. Dwayne Moody for News 5.